And what was the impetus behind starting the program?
Well, the government was looking forward and foreseeing that there would be a shortage on physicians, and our people are getting older and older and need more care and cure. So they foresaw a shortage on one side, but the other side was that they were thinking, well, our care costs a lot of money, and we see that a lot of physicians who are highly trained are doing a lot of work which could be easily done by people with another education on another level. But that really, the idea came from the government. So they made this plan of starting this program, introducing the PA, and they found 2 programs in the Netherlands, in Utrecht and in Nijmegen. And they developed the idea and made this program. So in the Netherlands you can't apply for the program, you have to apply for a job as a PA in education. So you have to find yourself a physician that wants to train you for 2.5 years. And then you follow a program which you do rotations 2 days a week at all main specialties. You visit school 1 day a week and you work 2 days a week as a PA at that specialism with that specialist. So from the beginning you work as a PA student, and after 2.5 years you get your master's degree, but then you also have your registration as a physician assistant.
Weer van bovenaf aan, dus niet zo. Van bovenaf aan. Rijden. Ja.
The main goal, I think, of our program is that we learn our students to rethink about clinical problems. Most of our students are nurses, some are physical therapists, so we got a kind of range of professionals, health professionals, but they all need to change their way of thinking, and so they need to learn medical reasoning.
You have to grow out of your nursing role and get into the more doctor role, and especially with your own colleagues, which are the other nurses, and now you have to tell them what to do. But I think it actually went pretty smooth to go there. I didn't feel any troubles with that actually. So I don't.
Almost stepping into a new culture. You have to learn another language, another way thinking about problems, another way of behavior. So there's a lot to learn. those are the parts we don't learn in school. You have to do that on the floor. So that's really hard work, I guess.
So what makes you feel good about this job? I mean,
yeah, it makes me feel good. Well, I do like the part that we can do some practical things like bone marrow punctions and like the central venous lines. And on the other side, like if you want to do some researching, or there's space for everything. Yeah, and I just like to help the patients. I mean, we have people we make like they survive and some don't, and even if they don't, then there's so much trust they have in you that you can help them guide to their death, to their dying. Yeah, so that's what I do like about my job.
Even met deze uitslag hoor. En als je wil kun je met
what kind of patients do you normally have? Then mostly elderly, or?
I see all patients, so young babies to very old people. I visit people that are very ill at home. I help people when they are nearly going to die, and to give palliation therapy. Yeah, so in this practice there's actually not a big difference between the patient that I see or the physician sees. This is like our standard room for a physician. We have a department for investigations and for little surgical techniques over here. What I was talking about is that we have a relatively large building for an average general practitioner practice, and that's because we want to combine more functions together and work together with other healthcare workers.
Here, like, when you look at people, they take pretty good care of themselves here.
Yeah, it seems. Behind those curtains. Now, if you compare it to other countries like the US, people are less obese. They smoke less, they drink less. But it is increasing also here. So we're getting more and more diabetics problems. Maybe we are a very prosperous country. Our economy is rising. Reasonably not too much very poor people, although that is also increasing. And healthcare is available for everybody. So yes, we are doing quite well, but our problems are increasing.
Are you really busy here? Or?
We are really busy, yeah.
Because of aged people or new people moving here?
Aging and new people and new people moving in. We have relatively more refugees coming over here, and but it's mainly because we think that a part of the care that is given in a hospital can be done more efficient when it's done in primary care. En cheaper.
Wanneer zij die brief krijgen, begint na te denken. Dat die mensen dus wel bewust donor kunnen zijn. Dat de vraag voorgelegd wordt aan de familie.
Not all Dutch have big noses.
So why did you get knighted?
Do we really have to talk about that? Somebody thought that would be a good idea. Now what happened that I, with a small group of students, we found that there was no legislation, there was not a professional organization, there was not a professional profile. We had nothing when we started as students. So when you're among the first people, you have to start walking. And then you get enthusiastic and you like this, yeah, being an ambassador and being a pioneer. So then you can't step back, you have to go on. And then you are really going for legislation, and you are really going for a recognition of the profession. Well, then it takes some spare time, yeah, it takes some. So that's what you do.
So what do you do in your free time then?
Well, you ask it my wife. Yeah. No, I'm still quite busy with the PA profession in the Netherlands still. And I work here about 3.5 days, and I work 2 days in the PA program in Nijmegen.
Is climate change going to really affect the Netherlands?
Yeah, since we live for an important part underneath sea level.
Right.
And so all kind of measurements are taken to anticipate on that. You might not see it, but when you go over the bridge to Nijmegen, maybe in daytime you have a better look. They broadened the river to to keep us dry, because between the water from the sea and on the other side we get all the melting water from Germany and Switzerland.
Oh, right. Yeah, I was wondering if the rivers would back up some, so they widened them, huh?
Yeah.
Wow.
Yeah.
It's crazy.
I forgot my. I had a book with photos. I wasn't wearing a tie that day, and my wife knew what was going to happen. I was not aware that they were going to honor me with the night thing. So I was really planning to go in my travel suit, but then she really asked me to put on my suit. But I didn't put on a tie. Next moment I was standing there in the big football stadium where the mayor of my town came, and well, I was really shocked. So they don't knight you with a sword here. It's just they put on this cross, and that's it. Yeah. That is family. Yeah.
Thank you so much.
You're welcome. You're welcome.
Always
enough.
Well, you go first.
Guess.
The guest goes first.
Yeah. I take enough. Take more than enough, because they don't.
Dankjewel.